Good morning. No, you're not at the wrong hearing. This is the Committee on Health, Tourism, Military Affairs, and Senior Citizens. The chairman has asked me to convene this morning's meeting and to start hearing and to start it. He, like a couple of other witnesses, are stuck in traffic accidents. But I know that there are some people here, and I want to hear their testimonies so that they can return to work. And then we'll continue the hearing when the rest of the witnesses show up. Notice for these hearings were sent out to the media on Thursday, the 29th of March, and the second notice was sent out on April the 5th. We have two items on the agenda, and one of them is Bill 227. I will have the sponsor, Senator Luis Borja Muñoz, to introduce and explain her bill to us.
Thank you, Mr. Speaker. Thank you to my very sincere appreciation to all the people who came out here to testify on Bill 227. The intent of Bill 227 is to require that all health insurance companies provide coverage for breast cancer screening for both women and men within a certain age groups without copayment or deductible provisions. The bill's recommendations are patterned after the Medicare guidelines, since Medicare is the largest health insurer in the United States. Medicare covers a baseline mammogram at age 35 and annual screening beginning at age 40. This age range is consistent with the commencement age for the Government of Guam group health insurance mandate for baseline and annual screening, a mandate that has been in effect since 1991. In effect, the bill adopts the age provisions of Medicare and the no payment, no deductible requirements of the U.S. Preventative Services Task Force. Certain provisions of this bill differ from the Grade A recommendations of the USPSTF and are not supported by some of our health insurers. A close examination of the data and the reasoning behind the USPSTF recommendations and the recommendations of experts in the area of breast cancer show, however, the provisions of Bill number 227-34 are in the best interests of our community. Thank you. Thank you, Mr. Chair.
Thank you, Senator. We have three individuals that signed up: Lisa Geisinger, Marisa Rosario, come up, and Darlene Roberto. Please join us at the table. Why don't we start with you, Ms. Geisinger? Please turn on the mic.
Please.
There, okay. You're on.
Okay. Good morning. My name is Darlene Roberto, and I am an 8-year survivor of stage 2 invasive mucinous carcinoma and ductal carcinoma in situ, otherwise known as breast cancer, affecting both of my breasts. I was diagnosed at age 35 on September 30, 2010, when my children were just 10 and 7 years old. I found a massive and painful lump on my left breast the day after my husband and my mother's birthday on August 29, and within 1 month I'd undergone several breast exams, an ultrasound, 2 mammograms, and a biopsy lumpectomy. My whole family was in shock and scared, and my 2 sisters, ages 37 and 32 at the time, had to go through an emergency screening as well. I went through chemotherapy and radiation treatment on Guam and at the Breast Cancer Center at UCLA, and I remember my doctor saying that I was way too young at 35 to have an old lady's disease, and that she's seeing more and more patients under 40. All of these procedures and treatments required co-payments, and because my husband's insurance was from a private commercial insurance, these were manageable costs with no deductible. If I had a government plan at that time, I would have had to pay the co-payments and or my deductible before the 20% kicked in. At 35 years old, I faced my own mortality, and for one day only, I thought I was going to die leaving my family to take care of all the financial obligations that I left behind. I was stressed out, just thinking about how much this was going to cost and how embarrassed I would be to ask my family and friends to help me. And this is all after my diagnosis. I had already started my race to save my life. In these past 8 years, I have used my experience in navigating this journey to help and mostly just listen to many of my family, friends, and colleagues going through exactly what I went through, and all of them barely out of their 30s and 40s. There would always be a point in the conversation about money and how they need to have another diagnostic test after another diagnostic test, and maybe how the radiology company just wanted their money. It's so sad because I have to tell them that their life is worth more than anything, and knowing is the first step. So they pay for these tests because who is not going to do whatever they can to make sure they are going to be okay? Stress makes you sick. You can even develop cancer from it. Let's take this out of the equation from the beginning and allow young women, young mothers to know early on if they will need to put on those running shoes and superhero cape to save their life without having to worry about co-payments or deductibles. Having breast cancer is no longer a death sentence when detected early. On Saturday, April 14, I will celebrate my 43rd birthday, and my wish is for this bill to pass and become law.
Good morning. Thank you very much for your testimony, and happy advanced birthday to you.
Thank you.
Great. We're going to move on now to, is there anyone else, or have you both complete? Yes, ma'am. Please go ahead.
Good morning, Speaker, Senator Cruz, Senator Espaldon, and Senator Muña. My name is Marissa Rosario. I didn't come with anything prepared. I think I've spoken my story many, many times that I've practically memorized it. But I was diagnosed with stage 3B breast cancer at age 39. My baby was only 1. I've had an 18-year-old by then and 4 boys in between. So my life then just took a whirlwind, and I needed to decide what I was going to do. Fortunately for me, I was active duty military, so my procedures, everything that I've done here on Guam, by the way, was covered. I had a double mastectomy, I went through chemo, and I went through radiation. I've been in remission since August 2015. Not cancer-free yet because of the advancement of the cancer. But I have all hope. Now, I'm here because my daughter's an adult. She's 21. She's no longer going to be a military dependent under myself. And she's going to be one of the ladies out there who needs to get screened because of our history. My mom is also a breast cancer survivor. She's going to need to be screened early on, and she's only 21. Now, the gene that I have is not the BRCA. It's called ATM, and it is passed down by our parents. So I had a 50-50% chance of getting breast cancer, and now my daughter has a 50% chance of getting breast cancer, and that's extraordinary. That's significantly high in my book, so it's either you get it or you don't. Now that she's entering the workforce after college, I need her to be in that population where she won't have to worry about getting screened or paying these deductibles at a young age. So I am for, and I really hope that this bill gets passed, and you know, for the better for the community. Thank you.
Thank you very much, Marissa. Ma'am?
Good morning, Senators, ladies and gentlemen. Thank you for allowing me to speak on the subject that's very personal to me. My name is Lisa Geisinger, and I was diagnosed with breast cancer in August 2013. My cancer was discovered during my annual mammogram. It wasn't a lump that could be felt. I couldn't feel it, and none of my doctors could feel it. After numerous tests, mammograms, ultrasounds, biopsies, and MRIs, my doctors informed me that in my case, the mammogram gave the most accurate information. In August 2013, when I was diagnosed, I was stage 1 with breast cancer. By November 2013, I was now stage 2. While attending a support group consisting of about 40 women who were cancer patients and survivors, 16 of them were diagnosed under the age of 40. That's 40%. There are many things on Guam that need to change, especially with healthcare. But raising the age requirement for a mammogram, charging co-payments and deductibles is not a benefit for the people of Guam. This should continue to be preventative care, and early detection is key. What you decide today will affect the future of your family tomorrow. That's it.
Senator Smonsi, thank you very much, ma'am.
Thank you.
Are there any senators? I can ask the sponsor if she has any questions.
Well, I don't really have any questions, but I just want to say, first of all, congratulations to all of you for being survivor and still continuing on that path. And I did want to let everyone know that I did not have a short list of people to contact to come out and support this bill. It's astounding how many breast cancer patients we have here on island that were detected even under the age of 40. It just amazed me that even the people I knew, and I just met Marissa today, but there's just so many of us, and we need to figure out how to prevent it, and this is one of the ways that I'd like for it to happen. It already currently is covered under GovGuam insurance, and we'd like to continue that and follow the Medicare guidelines, since there are so many different guidelines out there, and everyone's confused. We're not sure, when do we get screened, and I think the most vital part is communicating with your physician, and I think if we have that opportunity to go out there and talk to them and not be afraid, this bill will help that happen. So I just want to thank you all for being here today. I know you took time out of your schedule to be here to talk about it, and my blessings and prayers to you. Thank you.
Thank you, Senator. Mr. Speaker? Vice Speaker, do you have any comments or questions? Okay. Senator Espadon? Senator Lee, you have any? Okay. Thank you very much for your testimony this morning. Are there anyone else who wish to provide oral testimony on Bill 227-34? If you're interested, to please come forward if you'd like to present any testimonies. If not, the committee will accept any written testimony after the hearing today. Okay. We'll now move on to Bill 243-34. I'd like to recognize Senator Jim Espadon.
Thank you, Mr. Chairman. Good morning, everybody. Mr. Chairman, Bill 243-34 mandates certain changes to the Government of Guam Group Health Insurance Program that would streamline the process and result in lower costs to the Government of Guam without compromising the quality of GovGuam health insurance. Currently, the legislative and judicial branches of government may choose to enter into separate health insurance contracts for their employees or choose to remain with the executive branch health insurance contract. If the legislative and judicial board march first, the Government of Guam health insurance proposal is developed between mid-February and mid-April, mandating that all entities under the executive department remain as part of the group health insurance and establishing the March 1st deadline for participation by the legislative and judicial branches locks in prospective enrollees for better rate development by the responding health insurance companies. This bill also, Bill 243, also requires that all GovGuam retirees and survivors enrolled in Medicare Parts A and B and who select Class 1 or Class 2 be enrolled in the Retiree Supplemental Plan, otherwise known as the RSP. At present, all participation in the RSP is on a voluntary basis, but the GovGuam Health Insurance Negotiating Team has been advised by its legal counsel that the statute must be changed to mandate required enrollment in the RSP. Many retirees and their survivors enroll in the PPO 1500 and become oversubscribed at great expense to the government. By mandating enrollment in the RSP, the government's contribution for Class 1 and Class 2 will be reduced, on average, by $255.14 per pay period, or $6,123.36 annually, and $518 per pay period, or $12,450 annually, respectively, per subscriber. As of January 2018, 399 retirees and survivors are enrolled in the PPO 1500 Class 1, while 79 retirees survivors are enrolled in PP 1500 Class 2. If all these subscribers are migrated to the RSP, the potential savings to the government would be $2,443,220 for Class 1 and $983,625 for Class 2, or basically for a grand total of savings of $3,416,846 annually to the government. Benefit coverage will not be impacted, as the RSP mirrors and even exceeds what Medicare offers as benefits. Additionally, the RSP offers treatment in the Philippines and other countries where Guam health insurance companies have provider agreements. RSP subscribers are also able to opt for dental coverage at the same rates as all other subscribers. Finally, Bill number 243 also mandates that the government of Guam contribution for retired employees and survivors shall not exceed 3 times the lowest premium for a single active employee. The bill also mandates that the current level of government contribution be maintained. Health insurance is one area where we can streamline things and realize some savings for the government of Guam. We must look at all of the saving options for revenue-enhancing measures in the days ahead. This bill, in essence, will help save the government approximately $3.4 million annually, at minimum. Thank you, Mr. Chairman.
Thank you very much, Senator. Are there anyone who wishes to provide any oral testimony for this bill? If not, I recognize any senator who would like to put anything on record. Vice Speaker?
Does this require then that the retirees who are not currently opting into the government plan will get deductions from their retirement pay to cover the health insurance?
Does this require that government I'm sorry, the
Since
question
it's
is,
making it mandatory that they kind of opt into the government's health plan?
no, it does not. It's not mandatory. Bottom line,
thought that's what
this is specific to those GovGuam retirees and their survivors who are under Medicare A and B. This would mandate them to enroll or be enrolled in the RSP program. In essence, what's happening right now is you have a lot of these retirees who are now under Medicare, and Medicare is their primary insurance.
Right, okay, I thought, I'm
Okay.
sorry.
Yeah, no, it's not a mandatory
Yeah.
thing for those who are presently not
Okay, right.
enrolled.
Thank you, Vice Speaker. Senator Lee?
Thank you, Mr. Chair. I just had one question. Would having the survivors or the retirees or their survivors enroll in the RSP, would that change any of them? Or, I mean, would that change their ability to keep their existing benefits? Would it change any of their benefits? Would it change their plan? Would it change their existing benefits, or would they gain any benefit from it?
They would definitely gain benefit by reducing their costs for health
Right.
insurance. In fact, it might even improve their benefits. Right now, they're overspending is what they're doing out of their own pocket. And as a consequence, government Guam, in order to match them or for their contribution, also is now overspending. And so the benefits for the RSP really is, because Medicare is the primary insurance for these retirees, the RSP is basically the secondary. Right. So even right now, even if they're enrolled in a present plan at the PPO 1500, Medicare is still the primary. And this just basically says, well, you don't have to pay for your secondary insurance, things that Medicare doesn't cover. And RSP is included already in the GovGuam health plan. So it would cost the government nothing, and it would cost the retirees nothing. So it's actually a benefit to both the government and the retiree, that they don't have to pull out of their pocket anymore.
And you mentioned a $3.4 million savings, potential savings.
Potential minimum, because that's the numbers that I gave were actually garnered through the GovGuam Retirement Fund, because in order to be reimbursed for their benefits from Medicare, they have to basically report to the GovGuam Retirement Fund. So we have identified that number at present. And again, when you add it all up and take a look at what it would save the government, it's about $3.4 million.
Okay, yeah, and that's also in BBMR's comments on this bill.
Yes.
Thank you, Mr. Chair.
Thank you.
Thank you, Senator Lee. Thank you very much, Senator Espadon. We'll go ahead. The committee will keep the record open on Bill 243, and we'll continue to accept any written testimony that the public may have until such time the committee closes the committee report. Thank you very much. The time now is 9 a.m. The public hearing is adjourned.